Hello and welcome to the webinar on integrating the A-Lift into an aesthetic treatment program. This is presented by myself, Sally Durant, on behalf of the Nouveau Beauty Group and also Ali Hussein of Sonic Medical. Today we're going to be looking at enhancing skin health in general in terms of a treatment, A-Lift being a treatment in its own right, but also in respect of combining the A-Lift to increase skin rejuvenation in line with other aesthetic procedures, both non-surgical and non-medical. For those of you who don't know me, I'm Sally Durant, and I work in conjunction with the Nouveau Beauty Group in delivering the education on the science and applications of the A-Lift treatment. And I also am in partnership with SIBTAC in the delivery of advanced level 4 qualifications for the Medi-Spa sector. Those of you who are familiar with the A-Lift already will know that it is a treatment which is founded in medical research with clinically evidenced technology. Ali Hussein is the inventor of the technology, which has had a profound impact on medical treatment for a number of advanced degenerative diseases. He is a senior associate of the Royal Society of Medicine, which is an honorary position given to very few people, and a member of the Institute of Electrical and Electronic Engineers. Initially, we'll look at the science behind the results that A-Lift provides to you as a treatment in its own right. Indeed, it can be incorporated into spa rituals and spa therapies, traditional beauty therapy, and advanced aesthetic procedures. Also, we're going to be looking at it as a conjunctive treatment to encourage the healing and remodeling of tissue post-procedure. And those procedures include such as chemical peels, laser, microneedling, and even injectable treatments. To remind you of the technology that the A-Lift uses, it engages two phases of the groundbreaking nanocurrent technology, which is an extension of microcurrent, which more traditionally used in non-surgical facial lifting. Nanocurrent is able to stimulate the skin at a much more intricate cellular level and thereby provide a boosting and regenerative action within the cells themselves. This is a profoundly useful and impactful technology. And the results are really very clear for all in terms of the results that we're getting from this treatment. The A-Lift essentially works alongside the cell's natural metabolism and helps to boost the cell's metabolism in its provision of its individual cellular functions, but also in terms of its cell regeneration, reproduction by mitosis, thereby causing the cells essentially to act as they did when they were younger, breathing new life into the cells. And if we look at the science behind this, the mitochondria of the cell, which you can see here illustrated on this slide, are literally the power plants of the cell. They take in the glucose and oxygen from our respiration and digestive processes, and they manufacture that glucose and oxygen to form heat and energy. On the production of that heat and energy, a chemical messenger has to carry that heat and energy around the cell, and that is called ATP, or adenosine triphosphate, indicated here. So this is a vital component part of the whole process of the transfer of oxygen and glucose into heat and energy to fuel the cellular activity. So you can look at this as the body's natural battery fluid, adenosine triphosphate, boosting the cells to behave as healthy, vibrant tissues. If we look at skin aging, therefore, as the natural reduction of this cellular energy, literally your batteries are running down, the energy levels in the cells are running down, and this causes the cells to perform in a less effective way. They start to wither, and indeed they can die early, and this represents, therefore, a significant element of the premature aging process. As the ATP battery runs down, the cells become tired and will eventually die early. Early apoptosis is the correct term for this and is well recognized within skin science to be an essential component part of early aging. So quite simply, reduced energy within the cells leads to early cell death and leads to cell aging. So if we can help to reboost this energy level, make the cells work more vibrantly as they did when they were younger, naturally we're going to be able to rejuvenate the skin, but also make the skin behave as a healthy tissue again. The A-Lift current and the A-Lift technology represents an element of medicine called Electro-Medicine. This is not new. It is a culmination of 50 years scientific research whereby electrical stimulation has been used quite intensively to boost the natural physiology of human cells, enabled to address illnesses, disease, and restore healthy cellular function, repair, and regeneration. So this electromedicine using microcurrents and nanocurrent can be used in the case of degenerative diseases, and indeed the research is proving very effective in the treatment of conditions such as kidney disease, diabetes, glaucoma, as well as skin conditions such as psoriasis and eczema. The clinical trials on the medical applications of the A-Lift are significant and impressive. And indeed, if you do want to look at this further, and I know that if you are medically trained, you will want to look at the clinical trials, so please do get in touch with the company to get that information. A-Lift uses 3 phases of traditional microcurrent, and in order to really understand the special nature of A-Lift as opposed to other microcurrent lifting machines, I want to just explain to you how that is a significant element. So first of all, microcurrent is measured in millionths of an amp. We use it predominantly in the firming of muscular tissue, but equally, again, medically, it has been proven to indeed boost ATP up to 500%. So in itself, microcurrent is extremely effective. But just bear in mind the millionths of an amp issue, because the nanocurrent, of which we have 2 phases in A-Lift, is measured in billionths of an amp. So much finer, tinier electrical stimulations. And the benefit of this is that microcurrent and nanocurrent together both mimic the electrical frequencies of the individual patient or client, acting upon the mitochondria in the cells. They can literally tune in to your natural biorhythms. And as I've just mentioned, the energy generators of the body cells are stimulated to produce up to 500% more ATP in order to reboost the energy levels within the cells, facilitating more active cell function and renewal, and of course, therefore, a rejuvenating effect. So we know that we've been using microcurrent for some time. But what is the superiority, therefore, of the nanocurrent inclusion? This is really the significant point of difference and is unique to the A-lift treatment. The issue is that intense intracellular regeneration is possible with nanocurrent. It uses a specific selection of electrical waveforms, currents, and frequencies to stimulate cellular metabolism, function, and renewal at different levels in the skin. Literally, it is able to work at the cellular level in a much more exacting way. The electrical currents are so small, as we've said, they were measured in billionths of an amp. They're able to synchronize exactly with the skin cells to recharge them. And the essence of this is in this comparison. Again, the millionth of an amp of the microcurrent compared to the billionth of an amp of the nanocurrent. And when you take that information and realize then that the natural resonance of a human cell, the natural biorhythm or electrical frequency of a human cell has been measured at 40 nanoamps, you can see that the nanoamp technology is vital to how this technology is particularly effective. It's literally tuning into the cells. Using nanocurrent, therefore, we can gain a more intricate control. The dosage of the current is actually resonating at cellular level. When the unit was tested using a picoammeter, the proof in terms of the delivery of the nanoamp technology, which is significant new science, is clear to see. There is a video available of Ali Hussein actually conducting these tests, so that is again available through the company. But here you can see the results. In terms of the treatment modality, there are 5 phases in the treatment, and they include lymphatic drainage, lifting of the tissue, working on the muscle cells. Muscle fibers are actually cells also, so increasing muscular cell health is equally effective, but manifests particularly in muscle toning and lifting. Then we have cell regeneration at phase 3 and 5, different levels of cell regeneration. And again, we have another lifting phase at 4. So 2 liftings, 2 cell regenerations, and a lymphatic drainage. And then when you look at the statistics over here, for lymphatic drainage, we have 70 to 80 microamps, 160 to 200 microamps. And then at cell regeneration, stage 1, 160 nanoamps to 180 nanoamps. At lifting, again, we're back to microamperage, 150 to 250, and then back to our nanoamp technology at 55 to 75 nanoamps. And as we've just mentioned, the regeneration of cells, a cellular resonance, is 40 nanoamps. So at these levels, we are very able to stimulate cellular metabolism and reproduction. So another area in which the research has shown a huge impact is the action that the nanocurrent has on the sodium-potassium pump. This is something which actually sits on the cell membrane and is responsible for powering sodium and phosphates through the cell, which are used then to generate energy. It's literally like a little overhead crossing, whereby the sodium here, indicated by Na+, and the potassium here, are conducting themselves through the pump with the production of ATP. And as we know, the ATP then works with the mitochondria to carry oxygen and the energy produced by oxygen and glucose to the areas of the cell to power its function. So literally, A-Lift is breathing new life into skin cells. This is a remarkable technology, and it also works in terms of tuning into your electrical frequencies. Not only is this an action in its own right, but A-Lift additionally monitors and adjusts the production of its waveforms, enabling it to adapt and tailor itself to the individual skin and the individual client. It adjusts its production of waveforms every 16th of a second, and this maximizes the synergy with the individual person because everybody's frequencies will be different, and equally every individual's frequencies are constantly fluctuating. So the fact that the A-Lift is reading those frequencies and adjusting itself every 16th of a second means that this regenerative action is tailored totally to your client and they gain maximum benefit. We then look at the A waveform. This is a significant additional element of the action of the nanocurrent. The A waveform is a signal from the brain, which we know is only really relevant in any significant way in our youth. And it is the brain signal which triggers to stimulate growth within a young person. It has been found that the technology of the A-Lift stimulates this waveform. And in this respect, it stimulates the cells to behave as if they would in a young person, literally regenerating and rejuvenating the cells of the body. So it's clear that the implications of this to anti-aging is pretty significant. So in summary then, the A-Lift current boosts ATP in the cells by up to 500%. It re-energizes all cellular metabolism and function, increases keratinocyte cell renewal by mitosis, and increases the protein synthesis of collagen, elastin, and hyaluronic acid within by the fibroblast cells. The result is the cells are energized, the improved cell function is evident, healthy cell renewal takes place, we prevent early apoptosis, which as you may recall is early cell death, and thereby we prevent intercellular aging, anti-aging at intricate cell level, not just on the skin surface, which is how many other treatment approaches actually work. We're now going to turn to the clinical applications to the medical aesthetic practitioner and the skin health therapist in terms of the A-Lift treatment in its own right, and as a conjunctive treatment to assist us in our more advanced aesthetic procedures. Principally, the emphasis here is on the way in which A-Lift can help the skin cells recover more quickly. Many of our treatments in aesthetics are incurring a deliberate controlled wound to the skin, triggering the inflammatory and healing cascades which result in the rejuvenation of tissue. And naturally, if those treatments are going to be successful, the skin needs to be well supported in terms of its capacity to heal. Elements of improving approaches really of improving skin health prior to treatments like chemical peeling, microneedling, laser, etc. are vital if those treatments are going to be safe, they're not going to damage the skin by wounding it when it's not healthy, and equally post-treatment nurturing that skin and supporting that skin through the processes of healing and tissue remodeling. So A-Lift has three modalities: cell regeneration, lymphatic drainage, lifting and firming. And we just saw how the nanocurrent and microcurrent are producing those individual treatment approaches. So we're re-energizing keratinocyte cells and fibroblast cells for improved regeneration and function. We're revitalizing the lymphatic system to remove fluid and toxins. That helps to refine skin contour and general skin health. And it also re-educates the muscle memory cell to lift and tone the skin. The clinical indications, therefore, are for an anti-aging treatment in its own right, a general skin health improvement and maintenance, either again in its own right or in conjunction with other clinical procedures, whether in preparation for clinical procedures like chemical peeling and laser, or adjunctive to treatments alongside and post-treatment to increase healing and tissue remodeling as an ongoing process. You can see here two different methods of applying the A-lift treatment. The traditional probe applications are something which I know many of you will be familiar with in terms of microcurrent non-surgical lifting. This is a means of applying the nanocurrent technology to individual areas, whether it be for lymphatic drainage, muscular lifting, or indeed for overall cellular rejuvenation. Here above, you have a more clinical medical application, which is available to all by the use of electro-conductive pads, similar to those that you would have if you have a heart monitoring application. The benefit of this is that it basically spreads the current around the whole skin. It is something which is a standalone treatment. It can also be applied. So, for example, if you have areas of psoriasis on the body, it actually there is very useful. But this is a separate method, very good for the cellular regeneration element of the treatment, while these two, the probes, probably better for the exact lymphatic drainage, say under the eye, under the jawline, etc. And of course, muscular lifting and firming has a specific technique with the probes. So you can either use the probes on their own, or you can combine it with the pads. Okay, we're going to turn now to treatment combinations. And here you have illustrated some of the treatment applications that are indeed very effectively used alongside the A-lift treatment. All of these, laser and IPL skin rejuvenation, chemical skin peeling, dermal roller, and the mechanized dermatude or the mechanized needling pens, these are all instigating levels of wounding, whether they be epidermal, superficial epidermal, deep epidermal, or in the case of medical treatment, actually ablative, meaning that they remove the epidermis down to dermal level. So wounding these skins means that the skin has got to heal, it's got to recover, and it's being asked to produce new cells and new collagen and elastin in order to regenerate, and also more hyaluronic acid to hydrate the skins. But as we've already mentioned, these skins need to be healthy to produce a healthy and positive regeneration of the tissue. If they're unhealthy or struggling to cope with the deliberate wounding of the skin, not only will you not get good results, but you may actually damage the skin. And this is where A-lift in conjunction with these treatments can really help, because post-treatment you can actually significantly reboot those cells to work effectively in that healing process. So you're going to get better results, safer treatment, and a more happy client. In respect of what depth of peel or what type of laser indeed, or the depth of needling even, using alongside A-lift. So not just depth of peeling, but really depth and degree of wounding that we're using in these treatments. What is suitable? This is a question that has been raised. The answer is that, of course, the depth of your treatment will always be dictated by your client's skin. Not only the skin condition, but also the health of the skin. You're very much sort of you design your treatment program according to those parameters. So you can use A-lift alongside really any peel, any laser treatment. The issue here is how long you need to leave it until you provide the A-lift treatment. If you have a client, and if you're a medical practitioner, this will be potentially the case, or if you're a therapist who is dealing with a client subsequently to a more invasive treatment, you have got to allow the skin a little bit of time to settle down. So if there is active inflammation, or you're in an intensive post-treatment healing position, you're going to wait a week or two before you're going to start providing the A-lift. Essentially, the rule is you're not going to apply the A-lift over broken skin, raw skin. However, when you've done a peel that is epidermal, or you've done a laser regeneration, which is epidermal in its depth, non-ablative, in other words, it's not stripping out the epidermis, you can pretty much use A-lift straight away because it's non-invasive. It's really just working to boost the skin. It's non-inflammatory, and therefore supporting, not only supporting the activities of healing, also boosting the immunity systems, helping the cells that are the immune cells, the lymphocytes, the white blood cells. Those are also cells that will be recharged and re-energized and made to work more effectively and efficiently. You're improving blood flow, so bringing oxygen and nutrients to the damaged tissue, and thereby helping again to increase the healing and regeneration. So the essence of this, therefore, is that as long as you haven't, you're not dealing with a client who's had an ablative treatment where the epidermis has been essentially removed and the skin is pretty raw, you can use A-lift pretty much straight away. Same goes for microneedling. Microdermabrasion is a treatment which I know many therapists are doing very successfully. It's a less invasive treatment than perhaps peels and laser and microneedling, but nevertheless, it is causing surface scratching on the epidermis, which triggers the arachidonic acid cascade. And the arachidonic acid is the chemical messenger which tells the deeper layers of the cells, deeper layers of the skin, that there is a wounding on the surface, and thereby they need to instigate the healing mechanism. So the same level of support with microdermabrasion, post-microdermabrasion, is going to be effective. And so you're going to be combining your resurfacing treatment with a more in-depth healing and remodeling treatment. So for anti-aging, it's a fantastic combination. You're getting resurfacing and you're getting deeper cell rejuvenation. And that could be crystal microdermabrasion or diamond microdermabrasion, and indeed the hydrofacial as well. We have clients, clinics that are working very, very effectively with this. Jill Zander of Surrey, who is an award-winning clinic, she has been using the A-lift alongside the hydrofacial with extremely effective results. Jill Zander has also reported to us the efficacy of the treatment in conjunction with radio frequency. In regard to how this works, again, similarly, the intense heat of radio frequency radiofrequency is stimulating cells and causing a degree of heat shock within the tissue. And heat shock enzymes will work to, again, regenerate and repair what they see to be a wounding. That having been said, the principal effect of radiofrequency is a little bit like if you put a woolly jumper in a tumble dryer. It constricts the fibers, i.e. in the case of the skin, the collagen and elastin fibers, as opposed to the wool fibers in a jumper. But the effect is the same. It tightens and firms the network of fibers in the dermis, so you get a firming of the skin contours. Where A-lift can help this, in addition to actually boosting all of those cells and tissues in the skin, also the tightening and firming action of the muscular tissue is, of course, a very complementary action. So you're basically getting a double whammy, if you like. You're getting lifting and firming with your radio frequency, and you're getting lifting and firming with your A-lift. So you're going to get twice as good results. And incidentally, with radio frequency, there's no surface tissue damage. So once the heat has gone out of the skin, and that will happen within 12 to 24 hours, you can then start to reapply your A-lift. LED, this is a treatment which a light emitting diode. This uses, rather than using laser, it uses the which is invisible light to a large degree. It's going to use the visible elements of the spectrum. These days we talk about sunlight as being such a bad thing because of UV damage and radio infrared damage, but actually light is an energy that we couldn't live without. There would be no life on Earth without energy. We know that we need it to survive. And it has a very therapeutic effect as well, not only in terms of skin health, if it's used correctly, but also in terms of psychological health, because light produces the endorphins in the brain and gives us the happy feeling, which we know is the case when we see a bit of sunlight. So in terms of LED, LED is a specific light therapy which is beneficial to healing and rejuvenation. Here you can see the use of red light, which is the principal light for aging, for general skin health, effectively doing a very similar job to A-lift in re-energizing the cellular activities. And so the two things together naturally have a great synergy. You could combine a treatment of A-lift, do your A-lift treatment first, and then pop your client under your LED device for 20 minutes, half an hour, to really embellish and confirm the effects of your A-lift. So again, you're getting a double whammy. You're really emphasizing the effects. You've got a great combination treatment to sell to your client as a package. So financially, business-wise, you've got a much bigger offering for your client, but they're getting better results at the end. If you were doing this like LED, for example, on an acne skin, you would be using the blue light. When it comes to acne, obviously if you have an inflamed, infected acne, then there are issues that too detailed to go into here, which you would address with other treatments, or indeed it may be too severe and you need to refer to a GP or aesthetic nurse or doctor. When you have a skin, however, that is acne grades 1 to 3, you can treat that with A-lift and blue LED light very, very well. And acne 1 to 3 is anything from just comedonal acne to a light smattering of papules and pustules over the face. So the blue light in this case will kill the porphyrins within the P. acnes bacteria, which therefore obviously helps to reduce the infection. And your A-lift is going to help the healing and regeneration to avoid scar tissue. So the two things together, again, a double effect, a great treatment package, non-inflammatory, and very therapeutic. And use that alongside your retail products for the acne, and you're going to get fantastic results. And of course, this is something that children, and I say children, I mean mid-teenagers, would equally benefit from. And it's something that you can give to them when you can't give them peels and laser necessarily, unless you're medically authorized to do so. But this is a therapeutic treatment that will work. Mesotherapy is a treatment whereby we infuse active ingredients, whether they be homeopathic or paramedic or pharmaceutical, into the skin. Obviously, if it's a pharmaceutical grade topical, that is medical practitioner only. But there are many ways in which as therapists we can infuse a mesotherapy, a homeopathic element. Having said that, mesotherapy, by 2018, you will only be able to do that as at least the sort of more invasive type, with a level 6 qualification. But in saying that, I'm not including things like electrophoresis or iontophoresis, which you see here. So this is electrophoresis using a flat-ended blade, and also the roller, very familiar to you all, of galvanic. Of course, those are level 3 treatments. Here you have a nappage technique, which is an injectable technique that is medical only, whether it is using homeopathic ingredients or pharmaceutical. That is a treatment which, under medical supervision, can be provided at level 6, or it is otherwise necessary for you to be a medical professional. The treatment here that you see is one which is growing in popularity and is extremely effective, and will work equally well with A-lift. And I'll explain how A-lift works with these mesotherapy treatments in a moment. But here you have a sonophoresis using ultrasound on the skin, and the ultrasound, which literally sound waves causing vibrations through the epidermis to push nutrient ingredients into the skin. And you can see here a selection of the types of nutrient ingredients that would be put into the skin. So you have hyaluronic acid, which is a very, very common one. Aloe vera for hyaluronic acid for hydration, aloe vera for calming, moisturizing. Green tea is an antioxidant to reduce free radical damage. Vitamin A is essential for collagen regeneration, also an antioxidant. Vitamin C, antioxidant and needed for collagen. And then vitamin E to help the barrier function of the skin. And the way in which A-lift can work with this is essentially, what we need to do with these ingredients when they go in the skin is biometabolize them, get the cells to take them in and use them. And in addition, help the blood flow to take in those nutrients and spread them around the skin. So A-lift does all of those things. It increases cell activity, cell metabolism of these ingredients, and also it stimulates the blood flow to ensure that they're spread around the skin effectively. So a fantastic combination. And here you could do your A-lift immediately after the mesotherapy treatment in the same session. This question here we've essentially covered. How long should you leave before giving an A-lift pre and post treatment? Well, pre-treatment, of course, I would say you need to be doing a course of A-lift 2 to 4 weeks before treat. If you've got a not very healthy skin or a significantly aged skin, even 6 weeks before. So a course of 6 before those treatments, 1 a week, will ensure that that skin is really functioning in an optimum way and will thereby benefit from your more advanced procedures. for a skin that is quite well balanced, well hydrated, 2 to 4 treatments pre-peel, pre-laser, pre-needling, etc. Post-procedure, as we said, it depends on how invasive that procedure has been. Is it ablative, in which case you've got to let the re-epithelialization of the skin occur, so the epidermis has got to mend before you start putting anything else on it. And if the client has had a medical treatment, liaise with their medical aesthetic practitioner in terms of when they would agree it was appropriate to have the A-lift. But otherwise, where you've not broken down the epidermis to the basal layer, then as soon as any surface inflammation has calmed down, i.e. surface erythema, then you can start to apply your A-lift. And a course of 6 to 10 will always be the most appropriate. In terms of more medical conditions, just want to talk to you about this. If you're a medical practitioner using A-lift, it's obvious how this is going to, talking to you directly. If you're a therapist and you've got clients coming in who've had these medical treatments, then you do need to know what you can and can't do. So if the client has had PRP treatment, this is plasma-rich protein. This is where the client's own blood is taken, it's centrifuged so that the solid matter, the cells, are split from the plasma, and then the plasma, which contains all the nutrients, hormones, the vitamins, minerals, all the glucose, all of those good things are contained within the plasma, and then that plasma is re-injected into the subepidermal areas, into the dermis, for re-energizing and healing the skin. Now, this works as a form of mesotherapy, so really the same thing applies to A-lift here as it did with mesotherapy. It's going to help the biometabolism, it's going to help the take-up of the goodness that's being injected. There's very little post-treatment trauma in these cases. Just wait for the initial inflammation to go down from the injection sites, and also be aware that the injection sites, when they are fresh, potentially are an infection site. So you need to wait for those to heal, and that really takes just a couple of 3 days, depending on the client's capacity to heal. So again, if in any doubt, refer them to their medical aesthetic practitioner. If your client is having Botox, it is vital that you appreciate that the fact that the A-lift is stimulating cellular metabolism. In the terms of Botox, and indeed fillers as well, which we'll look at in a moment, the cellular metabolism will actually be breaking down the Botox. So if a client has got Botox, particularly in the forehead and eye area, you are best advised not to be applying your A-lift post-treatment, because it will reduce the life of that Botox. Having said that, it is a good idea to advise your client that should they wish to be keeping the muscle tissue healthy, because obviously the Botox treatment is causing the muscles to relax. So by passively energizing those muscle fibers, you're keeping that muscle healthy. Many people are concerned that their muscular tissue is idle for the time that they have their Botox in place, and an idle muscle goes slack, as you know. It's the same as a body muscle if you don't work it. So although the Botox will work less quick for a shorter period, but you will actually be enhancing the contour of the area, and you will actually be retaining the health of the muscle. If the client doesn't like that idea, and many people will be thinking, I've paid for my Botox, I want it to last as long as possible, which is quite obvious. A course of A-lift pre-Botox is going to really improve the overall effect of that Botox. You're basically going to be lifting and firming those muscles, and thereby the Botox, when it is provided, is going to be much more effective, and with less with potentially less Botox needed to be administered. It's also a case that for those clients who are averse to injectable treatments for whatever reason, of course, A-lift is an alternative, a non-injectable alternative, a holistic alternative to the lifting and firming of a Botox treatment. And indeed, the results are very, very comparable over a course of treatment, depending on the degree of the aging issues. Dermal fillers, these are obviously applied in different areas around the face to actually literally lift out and fill specific lines and folds. Here, really there aren't any nasolabial folds on this client, but it would be to address nasolabial folds, marionette lines around the mouth, at the side of the mouth, perioral lines around the mouth, and equally perhaps augmenting the cheek area or filling any line anywhere really. Again, the A-lift is going to increase the breakdown because it's increasing cell activity. The cells may well break down the filler a little bit more quickly than normal. So you may want to avoid, you can still do the treatment, but you just want to avoid the areas around the filler itself. One of the newest and most sort of actively growing treatment is the PDO Threads, which are otherwise known as a thread lift. This is where the client has threads inserted at the sides of the face, attached to the membranes in the center, and then are pulled, literally to lift the skin. In terms of using the A-lift alongside this treatment, same as with Botox, if you give them a course, and with anything, if you give them a course of A-lift, 6 to 10 A-lifts pre the PDO thread lift, then it's going to improve their healing capacity because they'll be quite bruised. It also helps to give a lift and firming pre-treatment, pre-lift. So again, enhancing their results and perhaps reducing the degree of the lifting non-surgical treatment that they need. Post-treatment, it's not going to, the A-lift is not going to impact on the lifting on the threads. The threads are very tightly secured. So again, it's really just a question of a complementary treatment that will improve muscular health, improve cellular skin health. So there is no contraindication there, but you would just need to wait for the initial swelling and bruising to go down, obviously. Many of you, we've already discussed the treatment of acne with the blue light and A-lift, but if the client is on Roaccutane, which is the medical prescription medication for acne, normally speaking, when somebody is on Roaccutane, you cannot treat them as a non-medical practitioner. The skin will be very fine, very thinned, very dry, very sensitive. So it is a contraindication to treatment without medical referral. Having said that, the essence of A-lift, especially when used with the electro-conductive pads, would not be implicating in terms of damaging the skin. Anything that is abrasive or harsh on the skin, a chemical or a physical, harsh, aggressive products such as a peel, microneedling, laser, you can't, a non-medic cannot do that, and indeed medical treatment equally is very, very constrained when somebody's on Roaccutane. But it is, in theory, a great combination that the A-lift would help the skin to recover, to be healing itself. But my advice would be that you would, as a non-medic, absolutely need to be working alongside the dermatologist who is treating this client. Once the client has come off the Roaccutane, in general, we would advise that you leave 6 months gap before you start giving any other topical treatment. So at 6 months, you can start to give the A-lift on a regular basis, as long as the skin has indeed healed well, and that will help to rebuild and strengthen the skin again. So really, what I'm saying is that for a non-medic, you're really going to be able to use your A-lift after the client has come off the Roaccutane and help the scarring issues and strengthening the skin, and leave at least 6 months. And if in any doubt about that, you need to refer to the physician who's treating the client, or ask them to ask them on your behalf, but it will be necessary to make sure that you have all the right paperwork in terms of informed consents and so on. Okay, so that really is the principles of treatment combinations in terms of aesthetic programs. Obviously, there are other treatment modalities. I think we've dealt with most of the principal ones. But essentially, it's vital to understand that you are boosting healing, boosting skin regeneration in line with these treatments. You treat as long as there's no profound epithelial damage to the epidermis, no inflammatory condition, obviously no infection, except for acne, where you can treat it in those cases, as long as it's only up to level grade 3. So let's now have a little look at the additional benefits of A-lift, and potentially this is a therapeutic use. We have 4 facial treatments going into spa rituals that can be incorporated into your treatment program. So they, for the therapists, are a great treatment in their own right. Of course, we're re-energizing and lifting the facial muscles. Remember, muscle fibers are cells. They have mitochondria just as normal cells as well. So you're actually making those muscles work more healthily, and thereby helping to improve their tone and lift on the skin. And here you can see the muscle tissue as an individual elongated cell. This will give you facial lifting and firming in all the normal ways: your worry lines, your frown lines, your crow's feet, your nasolabial folds, nose to mouth, smile lines, marionette lines around the lower part of the face, and also around perioral area, and of course on the neck as well. You'll be able to lift and firm the platysma and sternomastoid muscles. Increased blood flow to the skin. Those natural frequencies of the nanocurrent and microcurrent together are stimulating blood flow, bringing fresh oxygen and nutrients to the tissue. And of course, lymphatic drainage is a modality in treatment of phase in the A-lift treatment in its own right, helping to drain waste from the tissue, helping to reduce puffiness, and by reducing puffiness, you actually improve facial contour and general health of the skin. So that is our webinar for today. You may well have questions that in this presentation I haven't managed to address. So please direct any of those questions to Trish at trish.carey@nouveaubeautygroup.com. And the telephone number of the company is 0844 801 6835. So please get in touch with them, and either they or I will answer your questions. In the meantime, I'd like to thank you for listening to the webinar. If there is anything I can do to help you with other training, if you're working in the Medi-Spa sector, our SIBTAC, Sally Durant accredited Level 4 qualifications are in skin management and advanced clinical aesthetics, and there are our details if you'd like to contact us. But in the meantime, I'd like to say thank you for listening, and hopefully I shall see you soon for another A-lift education event, and I look forward to seeing you then. Thank you.